Good morning, everyone. I'm Eszter Bakó, and I want to introduce my 6 months work. I'm a pharmacist, and my PhD topic is to investigate the effects of topical herbal preparations on human musculoskeletal system and microcirculation. My vision is that the best product should be prepared based on the best science. In case of herbal therapies, they are often used without scientific knowledge. Therefore, my mission is to provide more scientific evidence for herbal therapies. To fulfill this goal, I am working on 2 projects. My first project is to investigate the efficacy of topically applied essential oils in musculoskeletal disorders. This is a meta-analysis. Musculoskeletal disorder is one of the most important global health issue. And essential oil therapy is a complementary treatment technique to treat musculoskeletal pain. However, benefits are controversial. Therefore, our aim is to provide more evidence for clinical use of essential oils in treating musculoskeletal pain. Our question is, how effective are these essential oils in musculoskeletal disorders? And we are going to focus on pain intensity, quality of life, and functional state. Using this search key, I performed a search in 5 databases, and after the selection phase, 12 eligible articles found. In this meta-analysis, pain intensity is our primary outcome, because this is the main reason for suffering in musculoskeletal diseases. Pain intensity is measured by a visual analog scale. The scale goes from 0 to 10. 10 means the worst pain. Pain intensity was measured in different time points in these trials. And according to this, we have created 3 subgroups. Immediately after the intervention group, 1 week after the intervention group, and 4 weeks after the intervention group. And the main reason for heterogeneity could be the small number of included articles. And the other reason could be that different essential oils were applied in the trials. Lavender essential oil was used in most cases, but rose oil, rosemary, ginger oils were investigated as well. And in my first forest plot, you can see the changes in pain intensity measured immediately after the intervention. The mean difference between the 2 groups is minus 1.19, which is more than a 1 unit decrease on the scale, which may indicate that essential oil therapy could be beneficial in treating musculoskeletal pain. This effect is statistically significant. In my second forest plot, you can see the changes in pain intensity measured 1 week after the intervention. The mean difference between the 2 groups is minus 0.69, which may indicate that essential oil therapy still has some effect after 1 week. This effect is statistically significant as well, so we can conclude that essential oil therapy may be beneficial in treating musculoskeletal pain. In my third forest plot, you can see the changes in pain intensity measured after 4 weeks. The mean difference is minus 0.22, which means that essential oil therapy has negligible effect after 4 weeks. This effect is statistically not significant. Therefore, we can conclude that essential oil therapy has no clinical importance in decreasing pain after 4 weeks. Despite the fact that different essential oils were used in the trials, the immediate and long-term effects show similar tendency. But To understand this effect, we need further investigations. Our second outcome is the stiffness. Stiffness is measured by a questionnaire. The scale goes from 0 to 8. And you can see that the main difference is minus 0.77, which means that essential oil therapy could be beneficial in treating musculoskeletal stiffness. The result is statistically nearly significant. So we can conclude that essential oil therapy could be beneficial in treating stiffness. We performed risk of bias assessment. We found some risk because the incompleteness of blinding. The research implication is that essential oil therapy is beneficial in musculoskeletal disorders. It can decrease this pain and improve functional state. The main strength of this meta-analysis is that it shows time dependency of the effect of essential oil therapy, and only RCTs are included. Limitations are blinding, small sample size, and heterogeneity. Clinical implication is that essential oil therapy could be beneficial for treating pain and stiffness, but repeated application is needed according to the results at least within a week. Research implications are improving blinding, reducing heterogeneity, and more essential oils should be investigated. So the main conclusion of this project is that essential oil therapy could be beneficial in reducing musculoskeletal pain. My second project is to investigate the effects of topical essential oils on human microcirculation. This is a protocol for a randomized trial. There are warm-up products or sport creams on the market. They contain those essential oils which are claimed to have hyperemic effect. Juniper and pine essential oils are ingredients of these sport creams. However, there is no scientific evidence for their hyperemic effect. Therefore, with this project, our aim is to investigate the changes in skin microcirculation induced by these essential oils. Therefore, our clinical question is, how do these essential oils influence the skin microcirculation? We are going to measure skin blood flow and the skin temperature by different techniques. The clinical implication is that essential oils the clinical implication is that we will provide more evidence for this hyperemic effect, and based on the results, we will be able to plan future clinical trials. And thank you for your attention.
Congratulations, Eszter. It's a fantastic presentation. I'm just curious if you go back to your first forest plot regarding your essential oils and this musculoskeletal disease that you are trying to treat. So this shows that immediately after the intervention, so the same day or within hours? What does immediately mean?
So after the application of the essential oils.
Okay, I understand. I'm also trying to figure out what kind of disease is included in the meta-analysis, because is that really placebo, the comparator?
Yes.
It's interesting that even in the placebo group, immediately after the intervention, I mean, if you give nothing to that patient, the pain diminishes pretty much, actually.
Yes, I have not mentioned, but there were 3 groups in the trials: the essential oil therapy groups, placebo groups, and the no intervention groups. And essential oils were applied mainly by massage, and placebo groups means that this placebo product was applied mainly by massage. So you can see the effect of massage itself.
Yeah, a very interesting presentation. Just one comment on your forest plot. Please indicate on the bottom line that favors treatment or favors essential oil or favors placebo. You know what I mean? On the bottom, on your figure.
Sorry, can you repeat that question?
On the bottom of your figure, you have these numbers, 0, -5, -10.
Yes.
So underneath that, you should indicate that favors essential oil, and on the other hand, favors controls. And you answered my... Sorry?
Thank you for your comment.
Yeah, and you answered my question, because that was mine, that I have a bad knee, and I don't use any essential oils. I might use it in the future, but when I just simply massage my knee, it eases the pain.
Yes.
So, but you answered my question. So, what are you going to do in your trial with the controls? Because your clinical implication slide jumped up very quickly, and I had no chance to take a look. Yeah, that's it. So, what will you do with the oh, it's placebo oil. Mm-hmm.
Yes, we are planning to use a placebo oil, which I know the blinding is difficult, so we have to think the way of the perfect blinding, but we are going to use some placebo.
And what is the device you are going to use?
To measure skin blood flow, we are going to use a laser Doppler.
Laser Doppler,
Yes.
That's okay. Right, thank you.
Well, I'm another patient, you see, not only him. I have also some problems. And that actually, I mean, relates to what you said, that essential oils are good, especially when they are actually combined by massage.
Yes.
So, is the massage alone a control in your study? Or some of the essential oils were used together with massage and some others are not? I mean, so where is dissected? What is the effect of massage and what is the effect of the essential oil?
Yes, in some cases they are used by massage, but not in each case. And we can calculate the effect of massage alone based on the results.
Okay, so that means that there was I mean, when you say placebo, that in some cases that's massage, and then in that case, massage and all. But, I mean, actually what you said, to me, it didn't came through. I mean, why is it especially good? Because that's not in the data, I mean, what you presented. So this is just your feeling, or you did some calculations on that? For the especially word, I mean. So that means that it is actually more effective. Essential oils are more effective together with massage. That means actually there is I mean, this can be analyzed statistically. This is just a feeling.
No, as I mentioned, there were 3 groups. In some cases, there were no intervention group in which no essential oils, no massage were applied. So based on the results, we can conclude that essential oil therapy is more beneficial when it's applied by massage, because in some cases placebo means no massage was applied, only just product containing placebo product.
In your studies, I mean, what you showed actually, sorry about this, you showed actually 2 groups. I mean,
yes.
And then in your text, actually, what you said that there were 3 groups. So how did you handle the 2 group versus 3 groups? So you always, so how did you do this?
So generally, there were 3 groups, but not in each study were these 3 groups applied. So due to the statistical analysis, we could show these results. But we have other results which are not which are not used for the calculation, but based on the whole data, we can conclude that essential oil therapy is more beneficial when it's applied by massage.
When you say that massage together with essential oil has a stronger effect, then you should be able to show that. I mean, that's possible, actually, when you compare, I mean, the combined treatment to the individual treatments alone.
Okay.
I think.
Thank you for your comments. We will consider it.